if you're someone who lives with persistent pain, my heart really goes out to you. I'm Dr. Chen, and in this video, we're going to deep dive into the world of pain. I'll help you understand why we feel pain, the different types of pain, and share some practical tips that have helped my patients manage their symptoms of pain and inflammation. Now, pain is something we all experience. It's actually crucial for our survival because it's basically a way our bodies signal to us that something is wrong. For example, when our hand touches a sharp knife, we feel pain and we pull away, so that protects us. So pain is actually a natural protective mechanism important for our survival, and pain is often a physical symptom of a process called inflammation. What's inflammation? Well, there are two types of inflammation, a good one and a bad one. The good one is acute inflammation, which actually helps our body heal. For example, if you do cut yourself with that sharp knife, you will likely see redness, swelling at the site where you cut yourself. That's inflammation. This is a process by which our body recruit necessary cells, and these cells come to the site of injury to help repair the tissue. This then forms a scab, and once that falls off, you now have new skin underneath. So in this instance, inflammation is good because it just helped you heal from a cut. However, when inflammation becomes bad is when it becomes chronic and doesn't go away. So in the example above, once your cut is healed, the inflammation shuts off and you don't see any redness or swelling at the site anymore. However, if the inflammation continued, you will constantly see pain, have swelling or redness at the site. This is known as chronic inflammation. And we now know that chronic inflammation actually underlies many of the common modern day diseases that affect us in the developed world, like arthritis, autoimmune conditions, diabetes, heart disease, and even Alzheimer's. So if you experience pain on a regular basis, it is likely that there is some chronic inflammation going on. And 1 in 5 people experience chronic pain. That's a shocking statistic. So it's not surprising then that 23% of people in the US take ibuprofen or Tylenol. These are over-the-counter painkillers every single week. Now, I'm not anti-medication, and I do feel medications have a place, but sometimes they're used as band-aids to cover symptoms like pain, which is an outward sign, a call for help from our body that something is not quite right. And I'm the kind of person that prefers to get to the root cause and find out what's causing the inflammation and pain, correct that, but also take necessary medication to help me while I address the root causes, which can take a while. So I'm not here to tell you to stop taking medications. That is something you should discuss with your doctor, but I do want to light up some new and exciting approaches to managing inflammation and pain that might be helpful. And more specifically, I want to talk about this one modality that helped my dad go from being bedbound from walking again after a week, and really is the reason why I co-founded LUMEBOX. Red light therapy was discovered for its healing powers back in the 1960s when a scientist accidentally discovered that red laser light promoted wound healing in a rat. Since then, the research has really taken off. Initially driven by NASA, who found that red light therapy helped astronauts heal cuts and bruises much faster. And then Dr. Hamblin, a trailblazer in red light therapy research from Harvard, wrote extensively to explain the many different mechanisms behind red light therapy for inflammation. And there are studies that also track inflammatory markers in controlled settings to observe the response to light, especially red light. Here's an example. So going back to my dad, he had a muscular condition called piriformis syndrome, which actually his doctors misdiagnosed him for sciatica, so he was on the wrong type of treatment. But the pain from damaged or inflamed muscle is intense. And there was a study done on injured athletes from the University of Pennsylvania assessing the role of near-infrared light on the rate of return to play. Obviously, when athletes are injured, they cannot play, and so it's important to get them healing ASAP. So in this study, they delivered near-infrared light using an LED device immediately after injury, and over 15 months, they treated a total of 395 injuries and tracked the athletes' pain scores using something called VAS, Visual Analog Scale. They also filled out a subjective survey about their pain, plus they tracked the time it took for each athlete to return to their sport. And in order to play again, the athletes needed to show that they had pain-free full range of movement. And this is what the study found. Treatments safely and effectively decrease both inflammation and pain in injured athletes, allowing a shorter return to participation in sport activities and training. And in this other study, a randomized triple-blind placebo-controlled clinical trial on patients who just went through a full hip replacement, They studied the immediate effect of red light therapy on inflammation and pain. The study was done on 18 patients. 9 patients received red light therapy and the other 9 received a placebo, a control, and they received the treatments 8 to 12 hours after surgery. For the red light group, the patients received both red and near-infrared LED therapy through 8 diodes and also 1 pulsed laser diode applied to 5 points over the scar. They measured pain using VAS again, so that's the visual analog scale I mentioned earlier. And to measure inflammation, they looked at changes to the level of inflammatory compounds in the body called IL-6, IL-8, and TNF-alpha. And this is what they found. Immediately following red light therapy treatment, there was significantly reduced pain compared to the placebo group, and there was a statistically significant decrease in IL-8 and TNF-alpha, the pro-inflammatory markers, in the treatment group. So basically the study showed that not only was the pain reduced, there was also reduced blood markers of inflammation in the 9 patients who received red light therapy. Now, how about if you have knee pain from arthritis? In this study, they looked at 50 people with osteoarthritis in their knees. They used either red, near-infrared, or a faint light device which looked like near-infrared light, acting as the placebo. The lights were applied to 2 points on the knees in patients with osteoarthritis for 15 minutes a day. They showed no difference in pain scores in those who used the fake light. However, in both the red and near-infrared groups, there was a 50% reduction in pain scores and improved function. This other randomized placebo-controlled study of 40 people using near-infrared light on their back also showed a statistically significant reduction in pain level by about 50%. The difference was marked towards the end of the 7-week study, suggesting that there is a cumulative effect, like the longer you used it, the better the results. And I like that they used a placebo control group. And what was interesting is the pain score in the group that used near-infrared light fell from 6.9 out of 10 to 3 out of 10. But the people using the fake light also saw a reduction of 7.4 out of 10 to 6 out of 10. Not as big of a drop in near-infrared group, but they also reported a drop in pain score. Now, how can red light therapy bring about this temporary reduction in pain and inflammation though? Before I continue, be sure to hit that subscribe button if you haven't already, so you get more science-based information like this about red light therapy. Well, both red and near-infrared are wavelengths in the light spectrum that can penetrate through our skin and travel to our cells, where it is absorbed by our mitochondria. These are the powerhouses that produce ATP, aka energy. If your cells have more energy in the form of ATP, they have more energy to heal faster. For example, red light therapy has been shown to influence fibroblast activity. These are cells that make collagen in our skin, which is not just great for reducing the appearance of wrinkles, they are really important to support tissue repair as well. So that's one way that red light therapy can help reduce pain and inflammation. There are some other mechanisms proposed in the literature which is fascinating about how red light therapy can reduce pain and inflammation. So this study published in the Journal of Pain talks about how red light therapy through the skin can trigger a cascade of events that ultimately leads to an altered perception of pain. For example, one study they highlighted found that shining near-infrared laser light on the back of mice for just 2 minutes helped them to handle pain better 3 hours later. How? Well, it's thought that light on the skin can actually lead to changes at the molecular level that reduce the activity of receptors involved in sensing and communicating pain to our brains. So basically it has the potential to alter the pain threshold. And this graph shows the increase in pain thresholds of mice that were treated with red light therapy each day. Pain threshold was measured before they used light therapy, shown in red, and 3 hours after red light therapy, shown in blue. So look at how much more the threshold increased after near-infrared light was delivered. And obviously, the higher the pain threshold, the less you would feel pain. I know we're not mice, but it's super interesting to me. So in summary, studies show that red light therapy could affect pain in a number of ways. Number 1, by temporarily reducing inflammation. Number 2, by helping any injured tissues heal faster. Number 3, by reducing the perception of pain at a nerve and spinal cord level. Now, I'm not saying red light therapy is a magic wand and it will work for every single cause of pain in every single person out there. Pain is actually very complicated, it's multifactorial, And I think it's really important for you to work with your doctor to find the source of your pain. But red light therapy could be a helpful adjunct to discuss with your doctor. We all experience pain at some point, myself included, and my approach is always multi-pronged. I make sure I'm eating an anti-inflammatory diet, avoiding anything that causes inflammation like excessive sugar, getting plenty of rest, as well as using my LUMEBOX. Usually the site of inflammation is deep, for example in a joint or muscle where I want maximum penetration of light. And we know that near infrared light penetrates better than red, so I usually do a round of LUMEBOX either in near infrared mode or combined mode. And if I have an acute injury, sometimes I alternate LUMEBOX with an ice pack. And what I mean by that is I will use LUMEBOX for 12 minutes over the injured site, and then I put an ice pack over it. Later on in the day, I may repeat all of this again, depending on how I feel. Remember though, more is not always better. I tend to avoid using LUMEBOX over the same area of the body more than 3 cycles in a 24-hour period. So for example, if I have an injured shoulder, I may use the LUMEBOX morning and evening. I tend not to use it more than twice in a day in general. Sometimes I go up to 3, but this is actually different for everyone, as I explained in one of our other videos. Everybody has a different maximum kind of optimal dose of light. And right now the science hasn't shown what that is yet for everybody. So there's a little bit of trial and error. And for me, usually 1 to 2 rounds over the site works best. No more than that for me. But this may look different for you. I also love turmeric, ginger, and bromelain for their anti-inflammatory properties too. In fact, ginger has been studied in clinical trials to be as effective as some of the over-the-counter medications. But here's the truth though, none of these are magic wands. None of them will work in isolation alone because pain relief requires a multi-pronged approach. And if you want a long-term solution, make sure to address your diet, your lifestyle, and find the root cause of your pain with your doctor. If you're ready to unlock the Swiss Army knife of healing that I love so much and that my family and I use for temporary relief of pain, head on over to the caption where there is a free ebook waiting for you and a special discount once you sign up for the guide. Thank you for watching, and be sure to subscribe for more content like this.